Oh, good evening to you. My name is Dr. Ben Jacob. I want to present to you the subject of ill health, the venue in which ill health is presented, how to look at it, and pragmatically in defining the venue of ill health, then how to respond to it in a straightforward and a rather simple way. Ill health must be understood as reflecting, apart from a principal issue of concern, a pattern of signs and symptoms. It is this pattern which begins to identify of your entire body, either a particular region, location, or aspect that is in some state of disruption. This collection of signs and symptoms, this pattern, is nothing more than identifying that the body itself internally is manifesting some sort of response to a poison by way of your immunological systems. And this defense response we can refer to as an internal defense and detoxing network. The body, in response to all poisons, will reflect the disruption in some form of an inflammatory process. This inflammatory process is reflected in some oscillating manner of the body, reflecting first an acidic reaction and then a response of neutralizing it with an alkaline response. The body will reflect this in an oscillatory way with decreasing expressions of severity until ultimately there is no longer this reflection of a pattern of ill health, because the body has completely neutralized and or excreted the poison that was of concern. The issue of chronicity of ill health will reflect with what we refer to as a condition of regulatory rigidity. This rigidity occurs either because the poison itself is not finding its way to the lymphatic system, or alternatively, the immune system is not having any response of any kind. What is imperative is to properly get some image of what this defense network looks like, so that all of us, layperson or professional, can properly understand that we're really not dealing with an over-concern of a microbe. We're wanting to properly and appropriately understand the terrain in which these poisons are finding an effect on what systems. And the best way to envision this defense network, this internal milieu, I would suggest to you is in the form of envisioning, if you will, a series of mountain ranges which surround a valley. The valley will have in it a lake. The mountain ranges will be Mount Neural, Mount Capillary, Mount Somite, and Mount Parenchymal. Parenchymal is a nice way of referring to the functional tissue of the organs. Somite, the structure, capillary, blood, neural system. These three mountain ranges are determinative of all bodily function. They communicate with each other on a continuum, but not directly. They require the lake as the means by which they communicate with each other. Therefore, the imperative is that this lake be clean. The body recognizes this and therefore sets up a filter mechanism on the fourth side of the valley. This filter mechanism is the lymphatic system. So that said, The importance then of the plasma ketone, is that it is in effect your own, my own, all of our matrix. It is the seawater. This seawater presents itself with high levels of solvent capability, metabolic action, both anaerobic and catabolic. It dissolves the chemical components. It modulates body temperature. It is the means by which this lake plasma finds the ability with efficiency to communicate information amongst the mountain ranges, if you will. The benefit then in using the plasma is that it will firstly offer nutritional support for one's own milieu, one's own matrix. It will coattail into the matrix any medicine you join with it. And once in the matrix, it will enhance all internal action of these mountain ranges amongst one another with the lake itself. So it is, and what I have found to be most central, dealing with all issues of ill health which are of concern to me as a physician, with all of my patients, with all that I convey to my students, and is central to everything which I do. I've submitted for your review some photographs of a couple of cases and a video. I leave it for you for your review and hope that you find benefit in its use. I thank you.